Lots of patients come in. I see probably 1 or 2 patients a day who have this complaint. They say, my ears are clogged up, my ears aren't working right, I think there's something in my ears. And I'll look in the ears with my otoscope, and of course the ears look clean. I can see all the way down the eardrum, and the eardrum looks clean and opalescent, and I see no problems with it. And so I have to have this discussion about what it is that's causing the symptoms that they're having. And for the most part, it is usually eustachian tube dysfunction. And eustachian tube dysfunction is a very, very common ailment. It's not an ear infection, it doesn't cause drainage at the ear, and it doesn't usually require a lot of antibiotics or big medications to clear it up. But it can be a very persistent problem and can be very difficult to clear. Eustachian tube dysfunction occurs when, I'll draw a picture because it's worth 1,000 words. So you have the ears on either side of, most people have an ear on either side of their head. And then they have an ear canal, which is the tube that goes from the outer ear down to the eardrum. And they vibrate when the tympanic membrane or eardrum vibrates, and then that causes the electrical impulses to go to the brain. You hear music and flute and sounds and all that kind of fun things. But here's the deal. Inside of this chamber is air, because these bones vibrate much more effectively in air than they would in a medium like water or something like that. Now, at the bottom of this room is a little tube called the eustachian tube. The eustachian tube goes down and it drains back here in the back of the throat. There's a little hole, and that's where the 2 eustachian tubes drain on either side of the head. And when you open your mouth or do that clearing thing that we do sometimes to clear our ear, and you hear that satisfying pop, those are the eustachian tubes opening. And when they open, that allows air to rush from our mouth up into that little cavity where those ear bones are. Now, some people say, well, why isn't there air in there all the time? Why do you have to have air go through your mouth up into there? Because you can't have an enclosed cavity, because if the barometric pressure changes, then that thing would blow up or shrink and it wouldn't work properly. You have to have the ability for the air to go in and out, because the eustachian tube attaches to the middle ear, and the eardrum forms an airtight, watertight seal. So if you were to pour water in the ear, it wouldn't go into the eustachian tube of the middle ear, it would stay in the ear canal. That's Mother Nature's way of protecting all the mechanisms inside the middle ear. So that's what happens. These eustachian tubes, which are normally open, what we call patent, sometimes become closed because of inflammation, irritation, infection, all that kind of thing. So it's a matter of getting them open again so that we can hear properly. We can give you medication like steroids or antihistamines or other medications to help open these up, and that can help speed things up and alleviate the situation. We can also do fun things like have you change what you're doing, like cut back on dairy products, milk, cheese, and butter, because that can cause thickening of the mucous membrane and cause problems. We can also tell the patient to increase their water intake, because that can help thin the water and thin the mucus and allow it to drain more easily. So there you go, eustachian tube dysfunction.